All right. I'm here with Dr. Russell Romano-Kelly. He's one of our 3 pediatric anesthesia fellows in the 2021-2022 class. Thanks for joining us today, Russell.
Of course.
Why don't you go ahead and tell the applicants a little bit about yourself?
Sure. So as Marla mentioned, I'm one of the current pediatric anesthesia fellows here at UCSF. I did complete my anesthesia residency here at UCSF, as well as I have done a pediatric residency at UCLA, and I did medical school at University of Texas in Houston. I have a dog. I love sports, such as like snowboarding, which is San Francisco is a great place to do that since Tahoe is really close by, and really like football as well too, and just like to get outdoors in general when I can.
Great. Yeah, we got some late snow this year. My opportunity to ski into April this year, which is unusual.
Yeah.
All right. So tell us a little bit why you chose UCSF for your fellowship training.
Yeah. So I really wanted to be somewhere where I had a really great anesthesia training with a really well-renowned name, as well as be able to take care of complex patients and cases. In addition to being in a desirable city with lots of indoors and outdoors activities and close to family for me. I'm already familiar with the city and like the population here, so it really made it easy for me to start fast, like right out of getting out of residency. And since the year is so short, I liked that ability to not really have to take a lot of time to acclimate myself to a really new place.
Perfect. And tell us about your fellowship year so far. What's been your favorite experience? How has the year gone for you?
Yeah. So overall, I think the number one thing with fellowship is I just really enjoyed the patients themselves. I really get like a lot of satisfaction for caring for sick children during challenging procedures. And it feels really rewarding to me to make this difference in the child and family's really stressful situation. And though they may not often express gratitude towards anesthesia, as we know, I really find it rewarding even when they don't realize what we've done. Rotations in particular too that I found like really useful and things that they haven't seen before. Rotations like the pain rotation, where you kind of get to see these patients after the operating room and see kind of the effects of your anesthetic, as well as something that we don't really get a lot of exposure to, at least on the pediatric side in anesthesia residency, is that we get a lot of trauma experience here too, which it's really like, I like it because it's kind of like a fast-paced environment where you really have to think on the fly a lot of times and be able to work together with a team that has really all just like met and has to kind of care really intensely for a patient for a short period of time.
Tell everyone what your plan is for next year.
Yeah, so next year I have a job that I'm going to be doing a mixed practice with a hospital group anesthesia. And so that's going to be like about like 50% peds, 50% adults in Honolulu, Hawaii, which is where I'm from.
Great. And any advice to our applicants as they're looking at programs and trying to make decisions?
Yeah, so I think a lot of programs have really great training in pediatric anesthesia. And I think the best thing to try and figure out for yourself is how to maximize the best and get the most out of your short fellowship year. To me, that really meant like being in stressful situations at work. So as mentioned, like trauma, really high complex cases like here, such as like organ transplants and things like that, really sick kids with a lot of abnormalities that I hadn't really like heard of before or managed before, as well as like cardiac, where we have designated months of cardiac, as well as the opportunity for cardiac cases throughout the year. So in addition to like at work, at home, I also wanted to be able to enjoy my year-end days off. So a really great place to live, which I feel like San Francisco checks that box completely. Both like I think work-life balance is obviously really important, and training itself is really stressful. And we've seen, especially with the COVID pandemic, the major issue being a lot of burnout. And I feel like having a good work-life balance, as well as having a good way to distract yourself from work sometimes, is really important. And I think San Francisco really provides a good place for that. So yeah, just a good ability to tailor your fellowship to the experiences that you want, whether that means more cardiac, more trauma, high acuity cases versus rapid turnover cases, whatever's going to be important for you in the future. I think trying to find a program that's right for you for that. So I've just really been able to appreciate everything that I'm able to learn from both my attendings and my patients this year too.
Great. Well, thanks so much for taking the time to chat with our applicants virtually, and have a good afternoon.
Of course, you too. Best of luck, everyone.